Thank you.
words for that. All right, magnesium sulfate, this is page 924 in your book. It is kind of wordy, just like Epi was, so I'm gonna try and clean that up a little bit. So what class of drug, what type of drug is magnesium?
Electrolyte.
It's an electrolyte, right? Just like what's in Gatorade, it's an electrolyte. It'd be like sodium, potassium, magnesium. If you remember, we talked a little bit about magnesium with the EKG stuff, like sodium went in, potassium went out, and magnesium had to go into the cell. So magnesium, it's an electrolyte. They also say that a class 5, not a V, that's a Roman numeral 5, class 5 antidysrhythmic. Antidysrhythmic stops a dysrhythmia. Dysrhythmia or arrhythmia means a abnormal, doesn't have to be irregular, it just has to be abnormal heart rhythm. So it's used to fix it. Cardiology is where we're starting next semester. I don't want to overload you guys with this stuff yet, but I'm going to make this very simple real quick. There's my official medical diagram of the heart. We have two chambers up top, they are atria. We have two chambers on the bottom, they are ventricles. Magnesium works on rhythm problems from the ventricles. Okay. Drugs you haven't learned yet, but you may have already heard of, like cardizem or adenosine, work on atria, magnesium, and iodine lidocaine work on ventricles. So when we get into trying to figure out where on the heart the problem is, that's reading the ECGs. That's where we literally start day one of paramedic 2. And trust me when I say there are 5 steps. Follow the steps, don't learn pictures, because you will not get it if you try to memorize pictures. Because I will show you the first day. Let's go through the steps. What is that? What is that? What is that? What is that? We'll probably put 15 or 20 normals up here, and every single one of them is going to look radically different with the wrong normal. So if you try to learn a picture, you're going to screw it up. But MAG works on the rhythm problems on the bottom part of the heart. So that's what they mean by the class 5 antidysrhythmic. So, mechanism, it depresses the CNS action. Pushes the CNS action down. Blocks neurotransmission, produces anticonvulsant effects, decreases acetylcholine at the end motor plate, slows the SA node conduction at the myocardium, and promotes calcium, potassium, and sodium movement into and out of the cells, stabilizing the excitable membrane. It also induces uterine relaxation and can cause bronchodilation. What the hell? It does a little bit of everything. So let's dumb it down a little bit. All right, cardiac. All right, fix ventricular rhythms from the bottom of the heart. Respiratory, bronchodilator. Uterine, this is a new one, like pregnancy, uterus, right? Relaxation. It does not mention that it is an antagonist to calcium. What do I mean by an antagonist? Blocks or does the opposite effect of calcium. So guess what? If somebody overdosed on calcium, magnesium. If they overdosed on mag,
calcium.
kind of get this one? All right. So it basically will do these 3 things. So giant thing here. So indications. Management of TDP. Right? Literally what the book says, TDP. What is TDP? TDP is an abbreviation for torsades de points. It's French. It literally translates from, anybody speak French? Twisting of the points. Okay, so I'm going to need you to use a little bit of imagination here. I'm going to pull out a prop to help this along. Actually, a better prop. Roll paper towels. So think of an ECG. And there's a unique ECG, electrocardiogram, EKG tracing. We'll say ECG, EKG, they are the same thing. ECG is the English spelling of cardiac, EKG is the German spelling of cardiac with a K. Germans are the ones who discovered it, so they're the same. When it comes from the ventricles, there's two and only two rhythms that come from the ventricles. They're both bad, Mag will work on both of them. One of them is ventricular fibrillation, or it's just shaking. Cardiac arrest! The other one is ventricular tachycardia. What does tachycardia mean? Fast. The ventricles are going so fast it took over. I'm not saying it's going 101, 102. No, it's doing like 180, 200. Boom, 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 boom. But it's all ventricular, coming from the ventricles. We know that by looking at the ECG, because ECGs are really wide. So it would look, different color here, it would look something like this, consistently. That is commonly called monomorphic VTAP because they're all the same shape. So I want you to imagine we drew this on the ECG paper, and this is going to be my ECG paper. Brandon, hold that. So they're all going the exact same way, right? Monomorphic, same shape. Twisting of the points, torsades, it's doing this. So what happens? It got bigger, it got smaller. It gets bigger, it gets smaller. It gets bigger, it gets smaller. But it all looks like that. Thank you. You can keep this. Right? That is what torsades is. There is one thing that causes torsades. Anybody want to guess?
Electrolyte amounts.
Specifically?
Magnesium.
Deficiency.
Low magnesium. Hypomagnesemia. It's the only thing that causes it. If we see that, it's caused by low magnesium, what do you think the treatment is? Magnesium. Right, or keep it. Walk into the bathroom, it's all good. Right, so that's the cardiac one. Right? It's caused by low magnesium. Respiratory, bronchodilator, after the other stuff isn't working real good. It has some smooth muscle relaxer properties. A little bit in the GI tract, but really in your airways. Albuterol is still my go-to. Atrovane is still my go-to. Solumedrol is still my go-to. And need a little bit more, we might try some magnesium. With all those things. The next step is epinephrine. That's got to be the, like, they've got a foot in the grave already. You know, it's got to be really bad to go with the epi. So it is an option down the road. You know, haven't quite thrown the kitchen sink at them yet, but this is getting close. You know, so it does have some smooth muscle relaxer, bronchodilator properties. Because it is also a smooth muscle relaxer, the pregnant woman, it causes the uterus to relax, not contract. So what is it going to do to labor?
Slow it down.
Delay it, slow it down, or stop it. Well, we do not want to stop labor. But after a woman delivers, she may have significant postpartum, after delivery, hemorrhage, bleeding. What do we want to happen? We want the uterus to relax, right? To prevent these spasms. So it may be used afterwards for that. That is a very rare thing. I have never heard of it being used in a pre-hospital setting for that, but it is used frequently in the hospitals for that. Much more controlled. For us, lights, siren, diesel, let's go. You know, like in the 10, 15 minutes we have them, it's not gonna be bad enough for us to set all that up. But it is an indication. So somebody can start asking a question. Yawning, whatever. All right. So indications, management of torsades, bronchoconstriction with impending respiratory failure, seizures during third trimester pregnancy or in a postpartum patient. Ooh. Going back up to the mechanism, a little bit of a CNS depressant. The pregnant woman who's having seizures. Not preeclamptic, eclampsia. The official correct term now is pregnancy-induced hypertension. But eclampsia, they're having seizures related to the pregnancy and their blood pressure. This is the go-to. Now, it will eventually stop the seizures and help prevent future seizures from happening. However, it takes a while for it to work. So if they're having a seizure, we need to stop that seizure. What would we use?
Percent.
Versed, Ativan, Valium, a benzo, which are all pregnancy category D. Dangerous to the baby. In this case, even though it's dangerous to the baby, if I don't stop the seizure, the baby mom can abort. We don't want that. So in this case, we're gonna stop the seizure. So it's usually we give the benzo and then immediately give the mag sulfate afterwards to prevent future seizures. Okay, so very few things we're gonna use this for. So I'm gonna put up the eclampsia up here as well.
Would you ever give it preemptively, like before?
If your protocol says. I have yet to see a protocol say do it preemptively, but that doesn't mean a medical director wouldn't say do it. I have been to, we had a pediatric clinic, or not pediatric, pregnancy clinic right by my station that we go to occasionally. And the doctors are like, yeah, her blood pressure's really high and excessive weight gain, she's got protein in her, all these pre-indicators. So we gave her some mag, we need to transport her to the Queen Palmer Hospital. And the patient's like, can I just go on my own? No, you have to go in an ambulance. Literally,
Yeah, and eclampsia.
it was across the street.
No, those are
Like from here
indications.
to my office was how far they wanted an ambulance transport.
Cardiac.
The doctor's like, I want you in the ambulance, and the patient goes, I don't wanna spend $1,500 to go 1,500 inches.
These are the indications.
Like, I'll walk, I'll waddle
Fix
across the
those,
street,
yes.
you know, so we'd get a lot of refusals, and they would walk across the street. But,
It is an indication,
Eclampsia.
yes.
all right,
This is-
contras, obviously hypersensitivity. Heart
I
blocks.
didn't know what you were asking.
Heart blocks are going really slow. It will make it go even slower. So if it's going slow, if it's a heart block, we don't do this, it'll make it worse. Okay? Where else are we? Cardiac damage, diabetic coma, because it's screwing up the magnesium. High magnesium. If you had blood work and they're like, wow, their magnesium's through the roof, it's 25. You know, do they need mag? No. Where else? Use with caution in patients with renal insufficiency. Okay. Side effects: drowsiness, CNS depression, respiratory paralysis, vasodilation, possible hypotension and bradycardia with rapid administration. If I push it too fast, all these things happen. So this isn't a bolus, it is a drip, it's an infusion. Okay. Dose: hypertension, right? Over 50 minutes associated with preeclampsia or the eclampsia. 4 grams, it's not milligrams, it's grams of a 20% solution over 20 minutes. Okay. Followed by 1 gram an hour, blah, blah, blah. If it's seizures, 4 grams of 50% solution, blah, blah. Eclampsia. So, my marker. Right. 4 grams over 10 to 20 minutes. Eclampsia, 4 grams over 10 to 20 minutes. Okay. Contact medical control, torsades. 1 to 2 grams over about 10 minutes. Bronchodilator, and status asthmaticus. 1 to 2 grams over 15 to 20 or 15 to 30 minutes. F that. You know what I mean by F? Frig that. Okay. So Ken's gonna make it simple. Cardiac patient, how many patients am I dealing with?
One.
1 gram. Breathing patient, how many patients am I dealing with?
One.
1 gram. Pregnant patient, how many patients am I dealing with?
2.
Or more? 1 over 10 minutes, 1 over 10, 2 over 10 minutes.
Sorry.
Ta-da.
Bronchodilator is 1 over 10 minutes also?
Yeah, one is officially I'm sorry. Yeah, it should be 10 minutes. Thank you. 1 patient, 1 to 2, 2 patients, 2 to 4. I don't know how to simplify it more than that. Does that make sense to everybody? Like, what's the emergency? How many people is this? It's 1. Okay, 1 to 2 grams. It's pregnancy. It's 2 to 4 grams. Question.
What about max and routes?
It's all IV infusion or IO infusion. Right? So,
What if we just put 2 grams over 10 minutes, probably?
you'd be okay. Right? What he's saying is, 2 over 10 minutes, 2 over 10 minutes, 2 over 10 minutes. Pretty simple. We good? Like this kiss, keep it simple, stupid.
How much is in the vial?
So the vials sometimes will come with 5 grams, sometimes will be 10 grams, depends on how your company purchases it. So you just drop 2, now it's usually like 5 grams and 5 mLs, or 10 grams and 10 mLs. Pretty easy. Oh, I need 2 grams, that would be
2 ml.
2 mLs. And you would just draw that up, put it in a bag, piggyback that bag in like we did a previous skill, which we'll come back to. So nothing too crazy weird hard there. Like, pretty straightforward drug. Onset. The second it hits them, it's working. It's an electrolyte. Boom, it's working. Peak effects, it's going to depend on how low their magnesium level was. Duration, about 30 minutes. When you shut it off, about 30 minutes later, it's worn off. So it's one of those that is working pretty immediately. Okay. Special considerations, also a pregnancy category D. It is dangerous to babies, but it is the cure for this. So even though that's dangerous for babies, if I don't do it, they die. Now what if mom was here? If I don't do it, mom's gonna die. What if this was mom? Pregnant mom.
Try everything else first?
Maybe I don't want to do this, maybe I want to go with that. You know, nothing too crazy there.
Medium. Or variable.
Magnesium
Variable. It
toxicity,
varies.
right? Signs of hypotension, loss of deep tendon reflex, somnolence, and slurred speech, respiratory paralysis, and ultimately cardiac arrest. Somnolence, they get sleepy, they get drowsy. If I give it too fast, faster than this, their blood pressure goes. So if they're getting really drowsy and their blood pressure is dropping, slow it down. Give it over 15 minutes, give it over 20 minutes. I've given this drug probably 15, 16 times in my career. I've always done it at 10 minutes. I've never once had a problem. Never once. Okay? But if you do, just slow it down. Just set it up in an orange bag. Thanks, Dan. Got to put part of the icing the other way. Worst case, they stop breathing. What do we do? So, main indications, doses are basically the same. No, Well, let's talk pediatric dose. Where am I? Pediatric. Yeah. Pediatric torsades, pediatric cardiac one, 25 to 50 milligrams per kilogram. It is weight-based. To a maximum of 2. Right, once you get to the adult dose, you're at the max. Yeah. I don't know how many pediatric patients we're gonna see this or need to do this. Pediatric, we're talking like American Heart, like under age 8. Do we really think we're gonna encounter this? God, I hope not. Right, so pediatric dose, 25 to 50 milligrams per kilogram over the 10 minutes. Thanks.
Next 2 grams.
Hmm?
Max 2 grams.
Once you get to the adult dose, yeah. And that will be everything, every single drug. If it's weight-based and I get to the standard adult dose, we're done. Most of the time, you're gonna hit the adult dose somewhere between a 7 and 10-year-old kid. Most of the time. Like even epi. Yeah. All right, that's MAC. Now for the last one for the semester, on Dancitron. Right. Celebrating. Last one. On Dancitron, zofran. Everybody and their brother on the planet calls it zofran. Its official name is on Dancitron. You picked up the package, it's going to say on Dancitron. It's not going to say zofran, so you need to know the other name for it is on Dancitron. ONDANSETRON. On Dancitron. Okay. Yeah. It is a selective serotonin inhibitor, or receptor antagonist, or inhibitor. So it does have some neuro effects. But the reality, it is like an awesome anti-emetic drug. What's the emesis? Vomit, puke. Anti-emetic. Stops you from puking. Stops the emesis. Stops the nausea feeling, everything else. Very, very, very commonly given drug. Other than oxygen, zofran and albuterol are probably going to be your next most commonly given drugs. These are the big, big ones. Okay? So it blocks serotonin, a natural substance in the body that causes nausea and vomiting. It's getting rid of nausea and vomiting. Does not affect dopamine receptors, so it does not cause extrapyramidal reactions, EPRs. Most of your serotonin inhibitors will cause those reactions. We talked about that a little bit with Benadryl. Benadryl is the cure for those. This one does not, which is why everybody goes, give him zofran. Because all the other ones have that weird side effects. So zofran is the go-to. Okay. Indications to prevent or control nausea and vomiting. That's it. It's the only reason we give this drug. I feel sick to my stomach. Here's some zofran. I'm not telling you to give it to the person who goes, yeah, my tummy's upset. Right? The person who's puking, the person who's dry heaving, oh, hell yeah, they're dead. Nobody pukes in my truck. But judgment call, like, yeah, my stomach's a little upset. I'm a mile from the hospital. That person who's, ooh, retching over, dry heaving, puked 3 times before you got there, yeah, you're getting zofran. Right? A lot of times it's sometimes that nausea with the cardiac patient. Let's give this, we don't want them retching and vomiting. Okay. Contraindications. Yeah, they're allergic to it. And then there's one more. This one's kind of a big one. Long QT syndrome. We're again talking about an ECG. PQRST, everybody's heard that at least once before. So a long QT. That's the P way, right? So this would be QRST. They're talking about this distance right here. That distance on an ECG is long, right? So when you look at ECG paper, just have to have some right here. We are talking about all these little itty bitty tiny boxes of ECG paper. That QT interval is normally about 6 or 7 boxes. If it gets past 11, it's considered long. If you look at ECGs, you're like, yeah, it's fine, it's fine. Whoa, that one, I mean, it catches your eye, like, that is weird long. Because what it'll do is make that even longer, which is going to trigger them to go into, wait for it, SODS and cardiac arrest. So if they already have a long QT, we don't want to give them zofran. That is the biggest mistake a lot of people make with zofran. They forget to check that. So do they all need to get an ECG before zofran? Most likely. The 3-year-old kid sick to his stomach, probably not a cardiac issue, but anybody, I would say, over 40, okay, you may have some cardiac history, or anything that is a cardiac type complaint, you definitely want to look at the squiggly line first, right, just to make sure. Or ask them, hey, do you know if you have any history of long QT syndrome? They're like, what the hell is that? They don't have a history of it. Because the people who have that history, they're the ones when you walk in like, yeah, I feel sick to my stomach. I have long QT. You know, they are letting you know, because it is that big of a deal if they get this wrong. It most likely will put them in cardiac arrest. So, that's it. That's the only contrast. Long QT, are they allergic to it? Pretty simple. Used for nausea and vomiting. Side effects, headache, weakness, syncope, might cause some wheezing and bronchospasm. Never in my career have I had a patient get wheezing with bronchospasm. Say it might happen. I've never seen it happen. Okay. Dysrhythmias, like bradycardias, could also be SVT, supraventricular, above the ventricle tachycardia. Could also be VT, ventricular tachycardia. Right? Could also be torsades. Could also be heart blocks, could also be AFib, it could be anything and everything cardiac. It could change it all. So if we're giving this, do they need to be on a heart monitor? Yeah. Okay. Could cause palpitations, make them constipated, might make them have diarrhea, hives, blah, blah, blah. Right? Avoiding giving it with any other drug that prolongs a QT, like amiodarone or levobuterol. Dose, 4 milligrams for the adult. IV, IO, some places have it as a tablet. This is how much the tablet is. 4 milligrams. So here's on Dancetron. Guess how much is in here?
4 milligrams.
4 milligrams. You'll find most things are packaged in the adult dose. 4 milligrams. Okay. They have the poisoning overdose, 8 milligrams, and 4 milligrams, the adult dose. How much? 4 milligrams. Pediatric dose, 0.15 milligrams per kilogram. I know, math, it's gonna suck. Right? How do you do 0.15 relatively quickly for the field? Can you do 0.1? So this kid weighed 20 kilos.
2.
0.1 is 2. What's half of 0.1? 0.05, right? What's half of 2? 2 plus 1 is?
3.
Here we get 3. 0.15 is 0.1 plus 0.05. So what's 10%? Half of that, put them together, there you go. You know, that's the real quick in the street. Pediatrics usually have a little more time. When the kid's sick. Is this something, honestly, is this something you're like, oh my God, I gotta figure this out right now, they need this set. You know what? Count on your fingers and you know, okay, it took you 2-3 more minutes. It's not like cardiac arrest, you know, so 0.15 per kilo. Onset, 30 minutes. I've noticed it's probably more like 15 to 20, but that may be a placebo effect. Like they know I gave them something, so they already started feeling better. Peak effects, over an hour, 10 minutes IV, duration 3 to 6 hours. It'll last for a while. Never once had to repeat it. Pregnancy B, meaning very safe to give to pregnant women. So those moms with morning sickness or whatever. Zofran, vitamin Z. It's not about that, just kidding. Right. The big thing is, we should do EKG, by the way. Any questions on this one?